The twins are our twin granddaughters. We have Peyton and Bailey. This is Jackson, our grandson. This is Kason, our other grandson. He lives in Texas, so we don't get to see him quite as much. That's our pride and joy, is our grandchildren. We take every day and enjoy spending our time with them. They got Papa wrapped around his little finger.
I was still in the Air Force. I was processing out when I had open heart surgery. That was, what, 2003?
Yeah, it was definitely scary. We went in the hospital thinking they were going to just do a heart cath and put stents in, and they took him to do the cath and came back out and got me and said, we've got him in intensive care, you can come see him. He had tubes coming out every part of his body and said, we're going to keep him in intensive care, and he's having open heart surgery in the morning. Then November of 17, he had a heart attack. And so we're doing cardiac rehab for our third time now.
You know, the heart is a very important organ. First, cardiac rehab is basically a medically supervised program that tries to help patients that have had, cardiac surgery, that be coronary bypass surgery, or had stents or valve surgery, kind of help them deal with the new life that they're going to be dealing with, and kind of help them, cardiovascularly feel better and get them moving in the right direction.
Medical West is an affiliate of the University of Alabama at Birmingham Medical Center. It's a great, smaller hospital compared to coming from UAB. Cardiac Rehab is a program, it's a comprehensive program that involves exercise and education to help the patient physically as well as psychologically.
After they've had a significant cardiac event, they're scared, they're worried, they don't know how their life is going to unfold from here on out, if they're going to be able to take care of their families, provide for their families, be there when their daughter walks down the aisle. And we're providing a service to help them achieve those goals and live their life.
I was scared. I was more scared, more so for my family, because they're not used to me seeing me sick. I'm not used to having others to do things for me, especially in the hospital.
I had significant heart damage, and I was tired and run down. And when I came to cardiac rehab, they kind of brought me along, and my heart is recovered, and I, got a real good exercise regimen.
If somebody's having a heart attack, the risk of having another one is actually much higher. And we know definitely that cardiac rehab, in patients that do cardiac rehab, the risk of developing that is significantly lower than those that don't do it.
I was, really scared to do anything because I was worried I was going to die. After you exercise, or at least for me, I felt better. And it felt good knowing that I was getting my stamina and energy level back.
It's a life-changing event, and they kind of want to understand what's happening and how they can manage their health, as well as get their confidence back that they're going to be okay. So kind of the gist of rehab, that physical component to improve their ability to exercise or to do physical activity, but also the emotional component or psychological component of, will this happen again? What do I do if it does? Those kind of factors.
The biggest issue with cardiac rehab is that it is underutilized. It's underused. Only about 30% of patients that are actually referred actually go and perform or be part of a cardiac rehab program. And one of the difficulties, it's for 12 weeks. It requires, somebody that calls the patient, encourage them. It needs most programs are far away from where patients live. So a lot of our patients that, are not able to travel 30 minutes downtown, and with the difficulties of parking and other complications, to actually do cardiac rehab. So actually having one here will be a big boon to our community. And I think it will help our patients live longer and better life and, be more successful in dealing with heart disease.
I think it's not going to be very challenging to get the population in here. We have the folks that are in this area that are in desperate need of cardiac rehab. The referral sources are there. It's just getting the staff and getting some of that extra equipment needed that we need in order to treat these patients.
It is a commitment, and you got to commit yourself. I 100% believe that it's the best thing you can do.
They need it, they need it, they need it. I mean, from a psychological, physiological, emotional standpoint, I benefited extremely greatly, although it's only now that I'm beginning to realize that the event affected my mood.
We have special needs grandchildren. We have twin granddaughters, and then we have a grandson that's 11 years old that lives about 2 hours away, and they depend on Pawpaw a whole bunch. So, you know, we want him to be able to enjoy the time with them because they like to come and we like for them to come, and we want him to be healthy and happy to spend time with them.